from a perspective of prognostication, the presentation of the IPSS-M by the IWG MDS group was a very important presentation, not only for the data and the analysis, but also for the potential clinical implication, because this may be the new scoring system for future also clinical research and clinical trials. The novelty, I think, lies in the incorporation of molecular findings, including mutations like FLT3 or MLL rearrangements into the workup of patients, and by doing so, you end up with subgroups of MDS patients with a very good or very bad prognosis. So I think it's a refined tool for prognostication, which I found very important, and which will aid also us in clinical research in the future. Apart from this presentation, I found various clinical trials important to mention. I will not go into, let's say, super details here, but I think the development currently also mirrors the one in elderly or general AML population, where we have aza-ven as a combination partner, I think, which is a putative new standard of care in also in MDS in the future, if the phase 3 trial reads out positive. And then we have now developments adding other agents to this doublet, including also studies with magrolimab. On the other side, a very important and pivotal trial has been also reported at the ASH for the first time, Pevonedistat plus azacitidine versus azacitidine alone, which was actually considered to be a registration trial. However, the study endpoint was not met, and so therefore the study is negative. So still, azacitidine is still the current standard of care for high-risk MDS patients. So this is, I think, a summary of a little bit what the development showed at the ASH meeting. A lot of things are going on with regards to also clinical research, but I think the jury is still out whether we will have a new standard of care for high-risk MDS in the next couple of years.